This volatility and all the new crises coming at us are now a constant. We used to say the new normal. It's not even new. This has been coming at us for quite a while. We live in very unstable times. Transitions like this don't happen without deliberate policy. Governance decisions which shape it are being made now, often by default. Health systems which aren't engaged in shaping these decisions are not avoiding the question, they're ceding developing the answers to others. The impact of global trends on health systems can be hard to foresee, but we really need to be able to anticipate better and not just react.
Our perspective of the future of the health system cannot simply be about expanding services as we used to ask in the developing countries. It's about building the systems that can anticipate the shocks. The new normal is not the buzzword right now. It just becomes normal almost. So there's no new normal for us, it's sure.
There are many risk drivers that are beyond controls. We heard pandemics, we heard climates, but I'll just mention one, ultra-processed foods. And that is something that a small country like us have very limited leverage against the food and beverage industry out there. And that's why we need to, Singapore is now stepping up in the global health space because we realize that it is directly linked to our ability and our region's ability to address some of these global health issues.
The financing is very important. And you can see the demonstration of that when you talk about sovereignty. It means that you need to use your local resources, mobilize the resources locally, because it's not going to get better. Maybe, but for the near future, we don't see that. I'm sure you are following the news about the sovereignty, where Ghana is trying to use more of the resources locally through oil, cocoa, and all that to invest in the health system. And I think that is the way that we are going.
Most things in our society, in my lifetime, my experience of them has been completely transformed. I wonder when the last time any of you went to a bank was. Last week? Last month? Last year? And yet, when I was a child, people used to go to the bank all the time. People used to go to the post office all the time. How much has our experience of health care changed in my lifetime? That model hasn't changed for a very long time. That disruption that has happened in so many other industries is finally coming for the health sector. It is coming.
You may not think these things are affecting you, but as our colleague from Ethiopia said, a war thousands of kilometres away is draining your health system, the fuel it needs to keep things running.
The world has never been wealthier in financial terms. So there's $500 quadrillion, that's $500 trillion, that's sitting in the global financial system. So the problem is not one of scarcity, it's one of distribution. We can't be sovereign in health when the financial system is geared against us. I mean, at the end of the day, the economy is here to serve the people. The people are not here to serve the economy, so we need to get things right.
Next year, Ethiopia will serve 46% of its budget for debt. If that revolution comes from this room, I wish to see that like 23% of it, half of it. If we could move to the health sector, that's for me the sovereignty.
I see two patterns of change. One pattern is disruptive, it's a revolution, and another pattern of change is evolution, and making your existing system, institution, and policy evolve over time. And I think this is what makes this moment particularly complex, because these two patterns are not separate, and they coexist, and they interact, and they appear in different proportion across countries and contexts.